Non-Hodgkin's lymphoma awareness PSA introduction and definition. Non-Hodgkin lymphoma, NHL, is a cancer of the lymphatic immune system. It begins in lymphocytes, white blood cells that normally help fight infection. The lymphatic system also regulates body fluids. In NHL, a lymphocyte acquires mutations and grows uncontrollably. These abnormal cells accumulate and form tumors in lymph nodes or other lymph tissues. Symptoms of non-Hodgkin lymphoma. Watch for these warning signs, which can vary by tumor location. Swollen lymph nodes, painless lumps under the skin in the neck, armpits, or groin. Fever and drenching night sweats, often without any infection. Unexplained weight loss, more than 10% of body weight. Extreme fatigue, persistent tiredness or weakness, itchy skin patches or rashes. NHL affecting the skin may cause red bumps. Having one or more of these does not automatically mean cancer, but see a doctor to find out what's causing them. Call to action and urgency. If you or someone you know has any of these symptoms, don't wait. Seek medical help right away. Early diagnosis makes a big difference. Non-Hodgkin lymphoma can grow quickly, but it is often highly treatable when caught early. In fact, one cancer center notes that early-stage NHL has about an 83% survival rate, and even advanced stage cases often exceed 60% survival. In short, NHL's dual nature means it can be aggressive, but modern treatments can cure many people if it's found promptly. Risk factors. Several factors raise the chance of developing NHL. These include older age. Most NHL cases occur in people over 60. Weakened immune system. For example, people with HIV infection or those on immunosuppressive drugs after an organ transplant have higher risk. Family history. Having a close relative, parent, sibling, or child with NHL increases your risk. Chronic infections. Certain infections, such as HIV, Epstein-Barr virus, or H. pylori, are linked to higher NHL risk. Having a risk factor doesn't guarantee you'll get NHL, but if you have any concerns, discuss them with your doctor. Prevalence and demographics. Common cancer. NHL is about the 7th most common cancer in the U.S., with roughly 80,000 new cases expected in 2025. It accounts for 4% of all U.S. cancers. Age. Risk rises with age. Over half of NHL patients are 65 or older at diagnosis. Gender. Overall, men have a higher incidence of NHL than women. Race and region. NHL rates are highest in white Americans and in developed countries like the U.S. and Europe. These facts show NHL is not rare. It affects tens of thousands of Americans each year. Prevention methods. There's no sure way to prevent NHL, but general healthy habits may help lower your risk. Stay active and maintain a healthy weight. Regular exercise and keeping weight in a healthy range may reduce NHL risk. Eat a nutritious diet, avoid tobacco, and limit alcohol.